think I learned early on that things could always be better. And that if you surrounded yourself with people that really care about what they're doing, no matter what industry they're in, if it's healthcare or education or business, that if they really love what they're doing, they want it to be better. And so if you're with those people, the thing that you can do is hear how you might be able to help them do their work better. And by the same token, they will help you, since everything in systems is interrelated and connected. And so my work is in healthcare, but the people that I know that work in education, their work is sort of foundational, because if you have a higher level of education, your level of health automatically is higher. So whenever I meet anybody that's a teacher or working in the school system at all, then I want to know what they love about it and what me in the role that I have can do to help them do that better. Because then when they do better, then my goals in healthcare are met. And so policy and systems change are all, it just brings us all together. I think after I'd been with St. Luke's Health Initiatives for about 5 years, we were evaluating how the funding was affecting the organizations that we worked with. And one of the insights was the organizations that got the least amount of money were the most successful and continued to be sustained, because when they got a big grant, they bought everything. Whereas the organizations that got smaller grants were doing what they absolutely love, and they recruited people to help them achieve their mission. And so 5 years later, no matter how much funding they had, their work continued. So that aha about, again, if there are people that love what they're doing, and you support them, there's going to be a lot more success for everyone. The advice that I have is, and it sounds strange, but volunteer for everything, because there's so few people to help do the things that need to be done. And so if you volunteer what you have a gift for doing, it's not hard for you, because we love doing what we do well. And so what I would suggest, especially in public health, is not only join your professional association and volunteer for leadership positions, because nobody wants to do that work. You gain that experience for yourself, but you also help that organization. But what I found in my career, no matter what work I was doing, I joined the Business Group on Health, the International Foundation for Employee Benefits. Those organizations, their professional training gave me so much more insight into what they needed, again, and expanded my sphere of people that I could work with that cared about the same things. And when you look at any industry, everybody wants, again, to be the best in their field. And so, again, when they're successful, if there are better schools, better businesses, better economy, then again, healthcare is improved. And I think everybody feels this. And the sad news is, I was mentioning earlier, I lost several people this year, and they have incredible legacies, and we are who we are. And so when you're remembered by your family, your friends, or your businesses, it's for your core. And my core is that I care about people. I love to hear what they love, and to hear how they're doing it and help them in any way that I can.